A nurse is administering blood to a patient who has a low hemoglobin count. The patient asks how long do RBC last in my body. The correct response is the lifespan of RBC is 120 days. A nurse is putting together a presentation on meningitis. Which of the following microorganisms has not been linked to meningitis in human? Difficile. A patient asked a nurse, my doctor recommended I increase my intake of folic acid. Which type of food contains the highest concentration of folic acid? Green vegetable and liver. A client with myocardial infarction is receiving tissue plasminogen activator alteplase. While on the therapy, the nurse planned to prioritize which of the following? Observe for sign of bleeding. A mother has recently been informed that her child has Down syndrome. You will be assigned to care for a child at shift change. Which of the following characteristic is not associated with Down syndrome? Oily skin. A nurse is caring for an infant that has recently been diagnosed with congenital heart defect. Which of the following clinical signs would most likely be present? Weight gain. A patient is getting discharged from a skilled nurse facilities. The patient has a history of severe COPD and PVD. The patient is primarily concerned about his ability to breathe easily. Which of the following would be best instruction for this patient? Cuff following bronchodilator utilization. A 50-year-old blind and deaf patient have been admitted to your floor. As the charge nurse, your primary responsibility for this patient is provide a secure environment of patient. A patient has taken an overdose of aspirin. Which of the following should a nurse most closely monitor for during acute meningitis of this patient? Management of this patient. Onset of pulmonary edema. A new mother has some question about phenylketonuria. Which of the following statement made by a nurse is not correct regarding PKU? The effects of PKU are reversible.